WHO's Surgical Safety Checklist is a tool created by leaders in surgery, anesthesia, nursing, and quality improvement to reduce the number of errors and complications resulting from surgery. The checklist outlines essential standards of surgical care and is designed to be simple, widely applicable, and address common and potentially disastrous lapses. Every operating room team can improve the safety and efficacy of care delivered to the surgical patients. The WHO Surgical Safety Checklist helps to improve surgical results and decrease deaths and complications. The starter kit also provides a detailed explanation of strategies for putting this checklist into place, means of identifying essential staff members and clinicians, and a guide for troubleshooting problems that are bound to arise during the process of implementation. So, this is the whole surgical safety checklist. So, before induction of anesthesia, these things are checked with at least nurse and anesthetist. Has patient confirmed his or her identity, site, procedure, and consent? And is the site marked? Is the anesthesia, machine, and medication check complete? Is the pulse oximeter on the patient and functioning? Does the patient have a known allergy, difficult airway or aspiration risk, risk of more than 500 ml of the blood loss, that is 7 ml per kg in children? Now, before skin incision, these things are checked with nurse, anesthetist, and surgeon. First of all, confirm all team members have introduced themselves by name and role. Secondly, confirm the patient's name, procedure, and where the incision will be made. Thirdly, has antibiotic prophylaxis been given within the last 60 minutes? Anticipated critical events to surgeon, to anesthetist, to nursing team. And lastly, is essential imaging displayed? Before patient leaves the operating room, these things are checked with nurse, anesthetist, and surgeon. The nurse verbally confirms the name of the procedure, completion of instruments, sponge and needles count. Specimen labeling. Read specimen labels aloud, including patient name, whether there are any equipment problems to be addressed. To surgeon, anesthetist, and nurse, what are the key concerns for recovery and management of this patient? Now, how to guide for WHO surgical safety checklist? First of all, build a team, meet with the hospital leaders, start small, then expand. Use the checklist, track changes, set public goals, update hospital on goals, update the hospital on progress, and continuity is essential. The initiative called Safe Surgery Saves Lives aim to identify minimum standards of surgical care that can be universally applied across countries and settings. By focusing attention on surgery as a public health issue, the WHO is recognizing the importance of improving the safety of surgical care around the world. The initiative seeks to harness political commitment and clinical will to address many important safety issues, including inadequate anesthetist safety practice, avoidable surgical infection, poor team communication. These have proved to be common, deadly, and avoidable problems across all the countries and settings, which we have already explained in the previous slide. Through a 2 years process involving international input from surgeon, anesthetist, nurses, infectious disease specialist, epidemiologist, biomedical engineers, and quality improvement experts, as well as patient and patient safety group, the WHO created a surgical safety checklist that encompasses a simple set of surgical safety standards that can be used in any surgical setting. Each safety step on the checklist is simple, widely applicable, and measurable. Thank you so much. That was all about WHO Surgical Safety Checklist. Subscribe on Obs and Gynae. Allah Hafiz.